This conference will now be recorded.
So, good evening, Mr. Walter.
Good evening.
Welcome. Yeah, welcome to the conference call. This call actually is it will be done on COVID-19 situation and how Frisco Police is responding to the situation. And we all represent Richwoods community, and there is an organization called Bharati Foundation, India Foundation. So Bharati Foundation has done many programs in and around Frisco as part of the service program that we do on regular basis. So, and you are part of the many programs that we organize on most of it. So Richwoods community is very obliged to you, Mr. Walter, for your kind service to the community since 2012, since the inception of the community. So in this COVID pandemic time, we just wanted to have a small Q&A session with you to bring more awareness among the residents of Richwoods and Frisco too. So to start with Mr. Walter, Frisco community do have a lot of questions that are unanswered. So could you please give us some knowledge on how Frisco Police is handling the COVID situation?
Sure. We've had to really evaluate and kind of change our operations in some regards because, as we all know, the person-to-person contact is a big piece of how the virus is being transmitted. And so, with that in mind, when this really started to develop, for Frisco, probably in early March, we knew it was kind of going on. It was starting to all the communities were starting to react to this. One of the things that our city did, and we were kind of in a unique position to do, was we really collaborated and got together as a group with the fire department and with emergency medical services. If you did not know, in our area in Collin County, we have an emergency management or emergency medicine director, and that's a doctor that works and basically kind of oversees how the emergency room departments at hospitals and how the fire department ambulances connect and talk to each other. And so that person for us is Dr. Gamber. And so Dr. Gamber was very much involved with Frisco Fire Department, Frisco Police Department, in coming together and kind of collaborating and giving us some, information about, how this virus is spreading and what might be some best practices for us when we're working, and so that we're trying to avoid transmissions. Part of that was setting up a plan on what do we do if emergency responders get sick. And so we set up an isolation plan and a quarantine plan. Part of that is, getting information on what constitutes different risk levels. What's considered a high risk contact versus a low risk contact. And, so we really had to educate police officers about what those risk levels are as they're engaging the public. And then we started setting up provisions for, personal protective equipment like the N95 masks. We have a kit in every police car that has a mask and gloves and eyewear for the officers to use when they feel like they're going to be in some type of risk level, so that they can don that stuff and mitigate for their exposure. So that collaboration has been very important. It's been very informative. It kind of keeps us optimistic that we're able to still deliver police services, albeit a little different, but nevertheless, still be out there, be present, and be responsive. We have done things internally in our building, in terms of moving to remote workforce. So folks that maybe traditionally work in an office are rotating out, working from home, and doing things that you're seeing in some of the corporate sectors where people are going more home-based. So those positions that can work from home in a laptop, we push that out. And then the other thing, we're doing screening through our dispatch center. So when people call the police for help, one of the things that dispatchers are doing is they're taking extra time to screen that individual, because if a police officer or a firefighter is going to come out and contact them, we want to have the best information available to us. Now, we all know about this virus that it doesn't always present symptoms, but we still are doing screening questions to kind of mitigate for our contacts. And, you know, in many cases, where it's not necessarily a crime problem, maybe it's, you know, a question or something like that, or it's a medical call. We have transitioned to, you know, being more socially distant. So we're not necessarily, you know, within a foot or two that we may be normally. We may be, you know, 6 feet or more away. But we're also transitioning to using the cell phone to talk to people. You know, they may be in their house and we may be out in the police car on the street, but we're just, if we feel like there's a risk, then we're going to use the telephone to communicate. So we're making those mitigation efforts to reduce exposures.
Yeah.
Now, in situations where we do have to arrest somebody and take them into custody, we're also doing screenings at our jail when they arrive. So we're doing temperature checks. Anytime we take someone into custody, we have masks for them. They will wear a mask while they're in our custody. So we have plans for when we absolutely have to contact people and make a custodial arrest. But we're also making decisions on, you know, whether or not a contact is necessary, you know. So we might see a reduction in traffic stops. We might see a reduction in certain enforcement actions, because we're trying to weigh the public health and our employees' health and balance that and try to keep a good, healthy balance with community needs. So that's kind of an overview of some of the things that we've done to change and transition since the virus has kind of hit our area.
So, Mr. Walter, you being the frontline warrior, you gave a good explanation, like how you are trying to not to get affected with it. But do you have enough officers in Frisco to handle the situation?
Yeah. So one thing that we've seen is with this situation, really, you know, we haven't seen a population shift. You know, our population is still, you know, around plus or minus 188. You know, getting close to probably 190,000 people. And so those numbers haven't changed. It's what has changed is the fact that more people are home versus being away at work and being away at school. And so we still have the same quantity of officers to service our citizens. And, you know, so we have a healthy amount of officers. Now, with school being out, what we have done is we have transitioned the school resource officers back out into the patrol fleet. And so what we're doing is we have our traditional patrol officers that are answering calls for service or taking reports or going to accidents, et cetera. And we're using our SROs as an insulator. And so the SROs are going into business retail areas like grocery stores. You know, they're going into our parks and rec areas. And so they are creating an additional layer of officers to be available should something more significant occur. So far, you know, we've been very fortunate in Frisco. I think overall our citizens, you know, are staying positive and reacting well to the best of their ability. And so we really haven't experienced a lot of social unrest related to this, thankfully. But we are, you know, we do have preparations in place. We have extra officers out there in our patrol fleet more than what we normally do. You know, the other part of this is we've had to cancel our training. We've had to cancel other things that might take an officer out of patrol duties and put them somewhere else temporarily for a day or two. And with those cancellations, you know, that just means we've got, you know, everybody, you know, here as much as possible.
Oh, so, yeah, go ahead. Yeah. So, Mr. Walter, the other question is the businesses that are closed right now. I mean, how is police I'm trying to protect that property because they are closed since so long.
Mhm.
We need to make sure that it's safe, right?
Yeah, and that's a big piece of that insulation layer that our school resource officers are providing. You know, while there are some businesses that have closed, there are also some businesses that have kind of transitioned, such as restaurants where they're doing take home only, or takeout only orders. There's been some transition there, so they're still there. They may have reduced hours. They may be, handling things more in an internet environment in terms of sales. But, in terms of protecting properties that may be closed for an extended period of time, that's where we're counting on our school resource officer workforce to supplement that coverage and have an extra set of eyes in those areas. And just to kind of give you an idea, we're talking about an additional, 25 to 25 plus police officers who normally work in the schools that are out on the streets, in addition to, a normal patrol shift is about 22 police officers. So, that's almost a 50% increase, in terms of how many officers are on the street. And that gets divided out. So, maybe another 30% more officers are out there. So that's really how we're handling the businesses, is getting that insulation layer of patrol specifically dedicated in the retail environments.
I have one big question, Mr. Walter. Has there been any reduction in crime, or would it escalate because of the impact of economy? This is one thing. And the second question related to this is, how would the elders and the vulnerable protect themselves from the opportunistic thieves and those fraudsters coming door to door?
Sure. So, in terms of crime, so this really kind of kicked off in March for us. So we're right now we're able to look at our data from March. It's still it has continued into April. So we're not done with April yet. So we haven't seen those numbers yet. But just to kind of give you an idea with March, and when we compare March to its monthly average over the last 5 years. So we look at every March over the last 5 years and we look at averages. We've seen big reductions, volume reductions. And give me a second, so just to give you an idea, when we compare this March with COVID-19 to the average over the last 5 years, we've seen about an 18% reduction in calls for service. We've seen about a 48% reduction in traffic stops. We've seen about a 12% reduction in police reports, 48% reduction in arrests. So we've seen a 25% reduction in accidents and car accidents. So we've seen reductions in a lot of these common areas, and that's probably primarily due to volume. The volume change, the environment change affected that. Now, where we basically have seen is we have seen some changes. So what we normally go to has changed during the virus.
I think, yeah, 10 or whatever, it's 89 cents a people.
So, for example, we've seen a big increase in city ordinance complaints. And so, as we all know, the governor issued his orders, our mayor has orders, the county judges have orders in terms of how we're going to conduct business during this time. And so there's ordinances in place for those orders to support that. So we've seen an increase in reporting in violation of those orders. And so that's really where we've seen an increase, is trying to address, how folks are responding to those orders, and talking to businesses and making sure they're compliant and stuff like that. And for the main reason of making sure everybody stays safe. Now, in terms of keeping people safe, a different thing that we've seen that people might want to consider is, we have seen some examples where folks have started selling things online. And so they'll do like a meetup and they'll sell something that they want to sell to a stranger. one of the things that we recommend is that if a citizen chooses to sell something to a stranger online, that they really think about their meeting place and that they try to make a safe meeting place. We've seen some examples where a citizen will give out their home address and they meet somewhere close to their home. That's really not safe because you don't know who's coming to try to buy this item. And we've seen some robberies happen like that where it's intended to be a sale. The person shows up, they're there to rob, they're not there to buy it. So what we advocate is, try to select a safe place to meet where it's safe for you as a citizen to sell something to somebody you've never met before. So that's an area where, as we're dealing with more online stuff, that people can really try to think through their safety. In terms of the elderly and door-to-door fraudsters, really it's nothing new. I mean, what we recommend is that, if you have a stranger at the door, really consider, do I have to open this door and talk to this person? We've seen a lot of people benefit from having the Ring cameras or some type of doorbell camera so that they can see who's at the door before they open it. And they can have a limited conversation through the Ring camera and make sure that it's somebody they know or somebody that they are expecting. But the other thing about it is, during this time is, especially for the elderly, is to look at their finances. Make sure that they or their family members understand what they're spending money on. If you have somebody show up and, we just had a storm roll through 2 nights ago, and it was a pretty significant storm. So if you have people come through and they say, oh, you need to get your roof fixed from the storm, don't accept that, because, if you really feel like you need to get your roof fixed, then, consider talking to your insurance company about having an adjuster appraise it. Consider doing your own shopping around and finding a reputable roofing company that can evaluate whether or not you really do need a repair. And so little things like that can help. Whenever something is offered up to you, don't just take it. Do your research, ask questions. But perhaps more important than the person-to-person is the online environments. There is a spike in COVID-19 related phishing schemes that are going on through email. A lot of links going on, donating money, just different things like that. So I recommend being very cautious of responding to unsolicited emails that have links in them, because that can be very dangerous and compromise online email servers and online financial systems. So that's something to be really pay attention to, especially during something like a viral outbreak, is falling into some of those traps.
So I'll just open. Anyone want to ask any question? Please go ahead. I'll unmute. Yeah. Do you have any questions, Krishna? Srini? So we have one more.
Actually, I have one question. What is the best place to get information about the laws changes? I think there is some background noise.
Yeah.
Yeah, I'm sorry, it was hard to hear that question. Are you looking
actually,
for
my question is, actually, there is some background noise coming. Sorry.
Yeah, good, Krishna.
Yeah, but my question is, like, the laws are a little bit changing, right, because of the COVID situation. What is the best place to get that information? What is the source of that information? Do we have to look at the news, or do we have to go to any website to get that information?
Yeah, so there's a couple of things to consider when you're looking for the latest update, because, as this evolves, things will change. And so visiting the website for the Texas governor, texas.gov, listening to what the governor is issuing is important to stay current with, but also locally following the city of Frisco's webpage in terms of what's coming from city council and mayor. Those are important things to stay consistent with and to monitor. The news media is doing their best, I'm sure, to put out, current information, but really as ordinances change and get amended, those have sometimes occurred here lately with, special city council meetings. And so I believe there's an opportunity to watch those city council meetings online. And so you can look at that through the city's website. And so I would recommend monitoring the city of Frisco's website and what we are publishing to the community, as opposed to reviewing it through a media source. And that can give you the most up-to-date and most timely information on when things change and how they evolve. Right now, and I didn't mention this earlier, but right now there's actually a reopened Frisco kind of task force, if you will, of leaders from different segments of the city that are coming together and meeting regularly to discuss, how we're going to transition and reopen. For example, we've seen new information on how the mall is going to transition to opening in terms of their hours of operation, stuff like that. But in terms of the law and the ordinance, council and mayor and what they are publishing is the most current information. That's who you want to monitor.
Gotcha.
Ram has a question. Ram? Ram, do you have any question, Ram?
Actually, I have one more question. That is it like, once the businesses start opening, right? So is it mandatory for customers to wear masks when we go to shopping malls, or is there any such a law in place right now?
I haven't seen something currently for our city that mandates the mask, but it is highly recommended. I believe what we look to is the CDC recommendations, and so we're trying to mirror those recommendations. And so my understanding is it's highly recommended at this point. Now, there may be other jurisdictions that require it, and so if let's say you want to go down to Dallas and go into Dallas County, then you might want to take a moment to review Dallas County's information and their website about what is current in their jurisdiction, because it could be a little different. So I would look at kind of the county level and the city level, and if you're going to be traveling somewhere, let's say you have to go down to Austin for some reason in May, you may want to, before you go, check the city of Austin and check Travis County and make sure you understand what their current ordinances are that are in place. But right now, the city of Frisco, my understanding is it's not a requirement under the law, but it is something that we're relying on the CDC as a recommendation, that it's a good practice to help, protect folks.
And the 6 feet distance, is that rule going to be relaxed, once the businesses start opening, or is that still going to be enforced?
I don't know long term how that's going to change. Currently, it's no more than 10 gathering in the 6 foot distance. As the businesses open up, there may be modifications to that. I know a lot of businesses are taking their own steps to kind of create that environment. Grocery stores and different places are putting tape on the floor to kind of create some natural barriers, if you will, that people will use. They may use segmented entries, where they let in so many people at a time. So I think we should be prepared for different practices with different businesses, but as a matter of law, I don't know how that will change just yet.
Okay. Thanks, Neil.
You're welcome.
Mr. Walter, one question from Ram. Ram was asking, Ram Maji, he's driving. What safety measures, already I think you answered about the mall opening, measures with mall opening, and 25%.
I'm sorry, you cut out at the end on your audio.
How will they 25%, especially in theaters?
I'm sorry, so you keep going in and out, but I think your question is, how are they going to enforce or manage like the 25% occupancy and stuff like that?
That's right.
Those plans are still being developed, and we have some ideas about them opening, and the businesses are going to be really at the forefront of managing their occupancy. I have not had direct contact with the theaters themselves, but I have read that the theater chains are looking at, how are they going to sell seats? Are they going to do every other seat? Are they going to do sections at a time? I don't know exactly how that's going to look right now, but the one thing for the citizens to know and what to expect from the police in Frisco, it won't be unusual that somebody may call us and say, hey, can you come evaluate, are they following the current orders? Are they at 25% occupancy and stuff like that? So, between the police and maybe the fire marshal's office in terms of looking at occupancy, we're going to come out and evaluate that. And if we feel like something's not being handled correctly, then we're going to communicate. Our goal through this has been to really emphasize communication and help people hopefully come to some voluntary compliance for everybody's welfare and for the greater good, as opposed to coming in and just strictly being an enforcement arm and issuing tickets and stuff like that. We have found a lot of compliance and a lot of relationships, working together type of things in transitioning. So there will, nothing, it may not be perfect. The transition may be a little rough in the beginning, but, we have an excellent relationship with the mall property and the owners there, so we know exactly who to talk to. And if we see things that aren't working, then we're going to collaborate together and make adjustments as we go. But, really we're relying on the businesses to help monitor their flow and their occupancy as we transition and kind of get back to a normal state.
Mr. Walton, today I have seen a couple of pest control people dropping in to the door, and they were not wearing masks at all. I mean, most of the people who are coming and knocking the doors to give some service, they're not wearing masks at all. I don't know why.
Yeah, and I don't know either. Some people may not have access to a mask. Some people, may not value the mask, or they may be concerned that the mask creates a barrier to acceptance. If sometimes there's a concern that wearing a mask, even though it's for our own good and safety, it interrupts that communication process between human beings. But what we need to remember is the masks are a recommended mitigation effort, and we should try to do it. Now, what I would say to that is, if you're uncomfortable and you see that somebody's not wearing a mask and you don't know them, and maybe they're at your doorstep and that would create a very close contact, at the end of the day, you have the choice not to open the door and engage them. Now, the other thing that can be done is you can post a sign on your door, that states, here's my phone number, or, if you're comfortable with that, or I don't want to communicate with strangers, I'm concerned about infection, so you can put a sign on your door temporarily during this outbreak that kind of communicates to strangers whether or not I'm going to answer the door. So there's different ways of handling people at your residence. That's why the technology is really neat and allows you to have a video and talk to somebody through the apps for the doorbell cameras. So that creates a natural barrier where you can still engage with people and talk to them and evaluate whether or not to continue. But at the end of the day, if you're not comfortable with the contact, then you do not have to engage in the contact.
And I have a question.
This is Krishna. Just I have one question. So nowadays we are seeing a lot of fake test kits on websites and fake curves and vaccines. Like some people are approaching like a charity scams and investment scams.
Right.
Like some people are even selling some medicine. Hey, you use this medicine in 6 days. Buy one get one free. So
Right.
is there any such kind of things? Did you notice across the Frisco? What is your advice? Around that topic. Thank you.
So a lot of these types of scams and businesses, they don't just pop up during a viral outbreak. They pop up around a lot of different themes where people are distracted and people are concerned about other things, or they're emotionally tied to something. And so they capitalize on fear, they capitalize on emotional investment, to try to get money out of your pocket. We recommend that you use and rely upon sound medical advice, whether that's from the CDC, whether that's from your own physician or your doctor, or whether that's from a hospital in terms of what to obtain to help you and what will help, if you do become symptomatic, what will help you through that time. So we really ask you to look towards the medical establishment to figure out what's going to work for you to make you feel better or avoid this. We do not advocate, these online environments or these sales pitches or, these magical cures and stuff like that. We need to recognize that these are maybe fraudulent or bogus or, maybe just not sound business at all. So in Frisco, we really haven't seen a strong push on that, but the money scams, they always make their rounds. In the past, we've seen money scams with immigration. You have somebody contact you, they say they're from immigration, and they want you to send them money on Green Dot. Go to the store, get a Green Dot card, and send us money, and you won't have any immigration problem. That's a scam that really started hitting very highly, even in our area, back when the country was really having a lot of discussions politically about immigration policy. So what they're doing is they're capitalizing on fear. And so what we can expect is that those conversations will transition away from immigration, and they may transition into scams around, COVID-19. For example, you may get a phone call soliciting you for charity donations for a cure that's being developed in another country. And to go to the store and get a Green Dot card and wire money outside the country. That's a big red flag. That's something to be very concerned about in terms of giving money away like that. If for people that want to help others and donate and stuff like that, I would look to your local communities. Here recently, we did an impromptu food drive for our Frisco food pantry. And that food pantry services families within the Frisco ISD borders. So I would look towards trying to support local community efforts as opposed to, sending money through the internet and out of the country or across state lines and stuff like that. The bottom line is do your research before you send something. And if you're feeling a lot of pressure from the salesperson or the person on the phone, if there's a lot of pressure there, that ought to be a red flag that maybe there's something not right about it. So those are just some quick advice tips in terms of dealing with that.
Hi, I have a question. With
all the shops and local businesses are opening, and as well as are we seeing any opening on the corporate offices as well? If yes, are there going to be any extra precautions, because we cannot control or reduce the number of people who get into the offices and all that? So any extra precautions in that area?
I personally have not heard about corporate offices. I haven't had that feedback. I would recommend communicating with your regional or local human resources departments, or through your corporate structures, in terms of how they're going to bring the workforce back into the office space. We have not heard any direct guidance on that, so I'm sorry I don't have a lot of information for you on that.
So aftermath, post-COVID situation, Mr. Walter, how is it going to be like? I know all the answers were pointing towards that, but aftermath would be really critical, right? Like, May 4th is May first week is something which is really they're expecting to be really peak COVID virus. It will be in May first week. So what is your understanding on that? Like, do we have to continue the same social distancing in first, second, and third weeks, or can we relax it a bit?
Well, I think we need to continue to follow the guidance from the state governor and the county and the city
CDC.
Council and mayor. They're going to continue to give us guidance in terms of how we phase into what we might consider to be our normal. This virus is really about human to human transmission and the contact there, and so that's where the social distancing really plays a role in how we manage and respond to who gets infected and how. So I'm certainly not the decision maker on those things, but I certainly see us continuing to advocate for social distancing, and that may change over time in terms of what that looks like. But I think moving forward, we still need to express caution in terms of our social contacts, and continue to wash our hands, continue to as we transition, we still need to think about those things. I don't think we're going to return to at least in the short term, we're not just going to draw a line in the sand and say, okay, we no longer are doing this. I think we're still going to continue to do some form of social distancing and sanitary practices, as we continue into the month of May.
Folks, any more questions? So, or else we'll.
I think no questions, because I think this is very, very informative. I greatly appreciate Walter, taking his precious time out and sharing the information with us. Thanks for ending the call.
So, Mr. Walter, to say the pandemic has given a great grief, huge grief to US actually. It has made big damage. When almost 50,000 people passed away with this pandemic, right? So, and the world even has become a big grief. So before, did you see knowledge? Do you have anything of this kind of experience?
I'm sorry, Shri, your audio is cutting out a lot on that.
Yeah, so, I mean, this kind of huge grief that came to US, like 50,000 deaths. Did you see this kind of situation anytime before? Like when compared to COVID, there are so many other viruses that really came to US, right?
Yeah. Now, in terms of my career, have I seen something like COVID hit during my career? I would say no, I haven't seen something like that. Now, we've seen other casualty events, over the last, 25, 35 years, but those have been different things. All of our countries have been involved in some sort of conflicts with war, and so you see casualties with war in our veterans. We've seen viruses that perhaps, are spiking in other countries, but don't really come to the U.S. in strong force. Africa went through Ebola and had a very devastating effect with Ebola. And while we didn't experience it on a large scale like some of the African nations, that was something that impacted other countries. So, this COVID-19 is, it's affected a lot of lives, and we all care about those lives, regardless of whether they're in the U.S. or Frisco, or whether they're in London or Delhi or wherever. So it's been significant for the world. So I would say I have not personally experienced in the police service something like this, in my local city.
Mr. Walter, thank you so much for giving us great info on this pandemic situation. And we'll keep on coming back to you as and when we need more information on any issues that we come across. And thank you so much for being in Richwoods for all the things that we were asking for. So many events we organized, probably you were there in 90% of them, attending, along with Mayor and David Shilson. You are part of the events in Richwoods. Thank you so much, sir. Any last word for the community?
Well, I just want to express how important it is to stay optimistic and to be positive. There's a lot of challenges. There's no doubt about that. But how we approach those challenges is important, and the type of teamwork and the relationships that we enjoy, make this bearable and make it doable. And so, as long as we do it together, we'll be okay.
Thank you so much, Mr. Walter. Thanks.
You're welcome. Thank you for having me.
Thank you, sir. Okay.
Bye-bye.